Oh. Oh. No, I thought you went over there with me. No. Oh, okay. So I think there were a lot of different stories that were coming in about baseball. That's right. Yeah, that he played there. Yeah, because there's another guy that played in the States that I met like the same week as I met BRS. So I think those stories probably. Yeah. Because I used to go for my mind. Sorry, man. I was like, who do you figure out? That was so funny. That lady was nuts. That was the funniest. Yeah, I know.
So I've only got one line of audio going out, so the top mic's turned off. Mine's mainly for shooting a journalist. Asking questions. More than fine. Thank you for asking.
He's got lighter. You know what? I was doing some construction stuff before this, and I had to have it wrong, and then I jumped out of the car, so I parked out there, and I was like, no, it's good because you can get around. It's great for the work. You can get across the street. You can get on both sides. Like the quarter shot. The sheriff's
Good morning, everybody. In the past week, more than 827,000 people in New South Wales have come forward to get vaccinated. This rolling average we're having consistently in New South Wales gives all of us heart and hope that around the middle of October, we will see 70% of our adult population fully vaccinated. To 8 p.m. last night, we had 1,431 cases of community transmission, and regrettably 12 people lost their lives, and we extend our deepest condolences to the family and loved ones for those of whom have lost their lives. As I've said previously, the best health advice I have is that we anticipate a peak in cases in the next fortnight. So the next fortnight is likely to be our worst in terms of the number of cases. But as I've said, it's not the number of cases we need to be focusing on, but how many of those cases end up in our intensive care wards and hospitals, and how many people we have vaccinated as quickly as possible. And the reason why the health experts suggest that that is when the peak is because after a fortnight, as you know, in the last couple of weeks, the amount of vaccines that we've put in arms of people living in those communities with high rates of the virus has been outstanding. And that will have a positive effect on the spread and the likely number of cases in around a fortnight. However, in terms of hospitalisation and ICU beds, there's often a week or 2 week lag, which means that the highest number of people in our intensive care wards are likely to present during the month of October, and that's why we'll be able to present in very good detail next week on all the preparation work that's been happening in the last 18 months to make sure that everybody can feel confident, if they do need those services, that they will get the best care possible on the planet as far as COVID and intensive care is concerned. But we hope it doesn't get to that. We hope people have been listening to the message, especially vulnerable people, and getting vaccinated, being protected and following the health orders. I just want to stress that you have nothing to fear about getting the disease. If you follow the health orders, and if you make sure you're vaccinated, that is the best protection. Stay home as much as possible and get vaccinated. Positively, though, I do want to say that I've been having ongoing conversations with the Prime Minister about more vaccines. What we've demonstrated in New South Wales is that almost everybody is keen to get vaccinated. And what has been a challenge for us as a supply is getting the number of vaccines from the Commonwealth so we can encourage all of our citizens to get vaccinated, whether it's through our wonderful GP network. Thank you to all the GPs. Through our pharmacies, thank you to all the pharmacists who stood up in a very short amount of time and now providing vaccine. And of course, New South Wales Health, who has been outstanding in providing those mass vaccination hubs, also going out to communities and also outreaching to those most vulnerable to making sure that all of our communities are covered. So any additional supply will be welcome, and I know the Prime Minister, as I speak to him regularly on this issue, is working day and night to get more vaccines to Australians, and obviously New South Wales will receive our share of those vaccines. Today we have with us Dr. Murray Wright, who is, as you know, New South Wales Chief Psychiatrist, and he's going to talk to us about some of the ways we can support primary school age children in particular through home learning. We know it's been a particularly difficult time for them, and can I again thank all the school children who've sent me wonderful stories and messages and drawings about what they're going through and given me some great ideas and suggestions, and I just want all of them to know that I really appreciate that and encourage you to keep learning at home, keep in touch with your friends in a safe way, and we know that in a short amount of time that all of us will be able to get back to what we enjoy doing. Dr. Gale will now give the health update. The Deputy Premier will talk about regional New South Wales, and then obviously Dr. Wright will present to us about children and home learning. Thank you.
Thank you very much, Premier, and good morning, everybody. In the 24 hours till 8 p.m. last night, there were 1,431 locally acquired cases of COVID-19 in New South Wales, and there was one overseas case reported. There were 154,654 tests reported to 8 p.m. last night. Currently, there are close to 11,000 people with COVID-19 who are being cared for by New South Wales Health, and the vast majority of those are being cared for in the community at home or in New South Wales Health's special health accommodation. Currently in hospital, there are 979 COVID cases admitted. There are 160 people in intensive care, 63 of whom require ventilation. And of the 160 people in ICU, 127 are not vaccinated. Sadly, today we report the deaths of 12 people in our community. And they are sadly a woman in her 30s from southwestern Sydney who died at home on the 1st of September after being tested on the 31st of August. Investigations are underway into the source of her infection. She was not vaccinated. The second person is a man in his 70s from southeastern Sydney who died at St George Hospital. He was a resident of St George Aged Care Facility in Bexley where he acquired his infection. A woman in her 80s also passed away from southwestern Sydney. A man in his 80s, also from southwestern Sydney. A man in his 70s from southwestern Sydney. A woman in her 70s, also from southwestern Sydney. Another woman in her 70s from southwestern Sydney. A man in his 70s from Sydney's north who died at Hornsby Hospital. A woman in her 60s from southwestern Sydney. A woman in her 70s from southwestern Sydney who died at Westmead Hospital, where she also acquired her infection. A man in his 70s from southwestern Sydney, and a man in his 90s from the Blue Mountains died at the Hawkesbury Living Aged Care Facility. We're very sad today to announce the deaths of those 12 people, and on behalf of New South Wales Health, I offer my sincere condolences to their families. We remain concerned in New South Wales about sewage detections in a number of places across the state where we have no known cases. And today I'd like to particularly encourage the residents of the following areas to come out for testing. And they are people in Jindabyne, Cooma, Bega, Bomaderry, Wauchope and Blaney. And finally, as we know, we continue to see the majority of cases, or a large proportion of cases at the moment, concentrated in the Western Sydney and Southwestern Sydney area. So again, a big thank you to all the people in those areas for following public health advice, for coming forward for testing and for getting vaccinated. And I'd particularly again like to encourage residents of the following suburbs to particularly follow that advice, get tested, get vaccinated. And they are people in Auburn, Guildford, Marylands, Greenacre, Bankstown and Liverpool. Thank you.
Good morning. I start by offering my condolences to the families that lost loved ones. You remain in our thoughts and prayers. Up to 8 p.m. last night in the Western Local Health District, there were 53 cases, 31 in Dubbo and 11 in Bourke. And for the community of Bourke, this is the highest rate in any reporting period, and we are calling out for that community and the community of Bourke to come out and get tested. Bathurst 6 cases, Walgett 2, Gilgandra 1, Narromine 1 and Forbes 1. In the far west there were 7 new cases and they were all in Wilcannia. In the Illawarra, 13 new cases, 9 cases in the Wollongong local government area, 2 in the Shell Harbour local government area and 2 cases in the Shoalhaven local government area. In the Hunter New England local health district, there were 11 new cases overnight. 4 in the Port Stephens local government area, 2 in the Lake Macquarie local government area, 2 in Newcastle local government area, 1 in Maitland local government area, 1 in the Upper Hunter local government area and 1 in the Armidale local government area. Again, in southern New South Wales, we mentioned yesterday 1 case, and that 1 case continues and is officially reported today. And in the Central Coast, again 8 new cases, and to the community of the Central Coast again to come out and be tested. Can I just give congratulations to the community of Parkes? They were the biggest mover in vaccinations over the last week. They went from a 36% first dose to a 66.5% first dose in just over 7 days. So again, congratulations to the community of Parkes. Again, a reminder to everybody in regional rural New South Wales about getting vaccinated. There are vaccinations, there are walk-in clinics, there's the pharmacy network, the GP network, and together we are fast-tracking the opportunity for vaccination in regional rural New South Wales, and we need to continue to get vaccinated. Thank you.
Good morning, everyone. We all know that right now across the state thousands upon thousands of families are juggling the competing challenges of working remotely, trying to keep the household afloat, and in many cases, homeschooling. I want to say a few words this morning to the families who are homeschooling, particularly primary school age children. It goes without saying that children are every bit feeling the restrictions that we're all working under as much as us adults. But children will all express stress differently, and they'll very often express it indirectly. Some children will act out, some will become clingy and very dependent, others will withdraw. I think it's reasonable, if there's any kind of change in behaviour in your school-aged children at this time, to assume that it's actually a statement of distress and take the opportunity to find out what's causing that distress. Quite often, the things which are upsetting to our children are actually things that they've overheard, misunderstood or misinterpreted. It's really important to try and have these conversations and to validate their distress, to acknowledge the things that they're missing out on and that they may have lost as a consequence of the restrictions, but to do so in a way which is non-judgmental. It's important to be validating, to be optimistic, to be reassuring, and to be encouraging of what's going to happen for the future. These things are really difficult to do when you're juggling all the other things that we're juggling every day. And the conversations shouldn't be on the run. It's probably a good idea to have a regular conversation as a family, perhaps over a family meal, to discuss these things when you're less likely to be distracted by other things. And so it's not just talking, it's listening and giving a really good opportunity for the family to discuss these things. It's not easy for us to do these things day in and day out over a long period of time under these difficult circumstances, but it's really important. And this sort of conversation on a regular basis as a family helps manage and contain any distress within the family, and it also helps people feel connected and supported as a family. And it's very, very easy to feel disconnected at a time like this. And just a reminder that children pick up on the emotional environment that's around them. They very, very easily react to strong emotions that are happening in the house around them, and it's yet another reminder for us to be very deliberate and very mindful about how and when we express our reactions to the things that are happening to all of us. There are actually some very good resources which are available to help with this, and one which has been recently developed up through the National Mental Health Commission in collaboration with families and their children and a number of other online providers is called Chat Starter. It's a deliberate attempt to try and get families and their kids to start these kind of conversations, and links up to a lot of online resources to help with stress management, particularly for school-aged children. Finally, you are the most important resource for your children. These things that I'm talking about are challenging and they're difficult and they have to happen day in and day out. It's really important to look after your own health, and if some of the things which I'm talking about prove challenging and difficult to sustain over time, talk to your friends and talk to your family about it. But above all, if you need to, look for advice, because it's out there, it's available online, by phone or in person. Thank you.
You said the numbers are going to peak over the next fortnight. What are those numbers going to look like? Do you know what that's going to cost for ICU? Talk about modelling.
Yeah.
Have it now.
Yeah, look, the modelling, excuse me, differ every day. Different variables are put into the model. So what we'll do next week is provide you the information we have at that time. But that's dependent on the fact that everybody does the right thing and they follow the settings. So we're pleased to provide that information next week in conjunction with our plans for how we've quadrupled our ventilators, how we've increased our ICU capacity, and what the plans are in place to make sure everybody has the degree of confidence I have that our system's been working at it for 18 months. But I just want to make very clear that every day there are models that are presented from within the experts we have in New South Wales, but also externally from non-government organisations. And nobody is going to get the exact figure right. Nobody's going to get the exact day right. But I've been very open with the information I have, and the best information I have is the worst number of cases is likely to occur in the next fortnight, because after that time, the number of vaccinations we've put into the community, especially in those local government areas of concern, will start having effect. And that's when we'll start to see case numbers go down. Having said that, though, we know there's a lag with the number of people who then will need hospitalisation. The experts advise, as we've done often, that serious illness tends to develop in the second week of infection. So given where the case numbers are and given that lag in time, we're anticipating October to be the worst month for our hospital system. But having said that, every day that goes by, we're seeing more and more of our population vaccinated, and that's the biggest weapon we have. And that's why I've said that the numbers that we need to look at very closely are obviously the vaccination rate, especially in our vulnerable communities, and then secondly, our ICU capacity and the number of people in our ICU system. And we will present that information next week, but I do qualify that by saying it changes on a daily basis depending on a number of variables. And one of the variables, which none of us can predict, is everybody doing the right thing. And unfortunately, in the number of circumstances that we get information on a daily basis, more often than not, everybody doing the right thing, getting vaccinated, staying home, following the health orders, in the main is safe. It's when others, a small number of people do the wrong thing. But having said that, we also know that Delta is horrible in terms of not presenting symptoms until a few days into the infection. So even people who are doing the right thing are caught unawares, and that's why we're just asking people, especially in the next fortnight, as we've done every day, to assume every time you leave the house. That goes for all of us. It doesn't matter what your postcode is. It doesn't matter what your circumstances are. Every time any of us leave the house, we need to assume we have the virus, and that's how we should treat people we're in contact with. So even with a mask, you need to have good social distancing. Even with a mask, you need to make sure you're following all the health orders, because we cannot be complacent. But what we do know works, and I know I don't mean to be glib when I say this, but in a few months' time we'll look back and realise that how worse the situation could have been in New South Wales. And I just want to commend all of our health workers, both on the front line but also our contact tracers. Every day they talk to people with the virus, they talk to their families and loved ones. They give us that information we need to present to you to make sure we're keeping everybody safe. So it's a complex system, and our systems in New South Wales are holding up incredibly well. But having said that, we know that, as I've always said, September and October will be the most challenging, because we'll be going through the phase of dealing with extra hospitalisations and extra ICU hospitalisations, but we'll also be going through both the exciting but challenging time of opening up. So those two things will be happening at the same time, roughly, but that is shouldn't be a concern, because we, as I think time will tell, every decision we make in New South Wales on behalf of our people is based on the best advice, is based on what is going to keep everybody safe, but also what is going to relieve our citizens of the burden of lockdown. And I'm looking forward to those opportunities. Ursula and then Clinton, yeah.
Premier, why not release that modelling now? And if not the number, can you tell us what is being done for these ICUs and their capacity now?
Yeah, well, already it's been on the public record that at any given time you have between 500 and 600 ICU beds, but we'd worked on doubling and tripling that number, in fact tripling that number, including staff, and I want to assure everybody of that. Now, we don't intend to use every single bed that's available in our plan, let me make that clear. But we need people to know that no matter what the numbers do in the next few weeks, no matter how scary or how high the numbers seem, that our system, yes, it will be stretched, and technically there will be very different procedures we put in place. People may not go to the hospital that's most close to their home. They may be taken to another hospital, because some hospitals have a lot of capacity. Well, I shouldn't say a lot, but many hospitals have capacity now that isn't being used, whereas we know that some hospitals in southwestern and Western Sydney in particular are carrying the burden, because that's where the caseloads are at the moment. So we will need to do things differently, but that's already been planned for. So when you get the daily stories about some different procedure happening, including at the worst of times when what is known as an intensive care ward will be expanded into other parts of a hospital, that is all planned for. Just because you hear about something done differently, I don't want people to be concerned by that, because that is what is in our pandemic plan. That is what we've planned for, what we've prepared for. So you will hear examples of how things are done differently. And next week, which is why we're releasing all this information, is we'll have clinicians, we'll have our health experts together explaining all this to the community, making it publicly available online so that everybody can feel assured that if they need intensive care, we don't want it to come to that. If you get vaccinated, it won't come to that. And if you follow the health orders and be extra cautious. But if those beds are needed, they are there. Our hospital staff have been trained, redeployed, and that is why we've taken a pause on some things, because when you know you're going to get the worst caseloads or the worst hospitalisation, you do have to make amends, you do have to pause, but it's only for a couple of weeks. It's only a temporary situation. And that's why we'll make sure that we provide all that information available. But I don't want anyone to think that we haven't spent the last 18 months planning and preparing. We absolutely have. And again, whilst the case numbers are numbers we've not seen before in Australia, given where we're at and given how much our systems have been holding up, I think when people look back, they'll appreciate, perhaps not now, we're in the middle of the storm, but in a few months' time, when people look back, they'll appreciate our contact tracers, our systems, and also the way in which we open up and how safe that will be. And people who are vaccinated will experience those privileges. And the timing could be at the same time we're seeing the worst numbers in our hospital system. But that shouldn't worry us, because it's part of our strategy, it's part of the plan, and it's how we calmly and efficiently move through the process of the next couple of months.
There are now numerous examples of somebody coming into contact with a COVID positive case and New South Wales Health not contacting them for upwards of a week or so, but the business involved contacting them or other people contacting them. Are we now at the point where we're relying effectively on businesses and citizen contact tracers, for instance, to do the job, to ease the strain?
No. Well, obviously, when we get to 70% double dose, we will be in a transition as to how we do a lot of things, including our contact tracing. When you have the vast majority of your adult population vaccinated, it does mean you do things differently, whether it's our quarantine system, whether it's contact tracing, and in the future, whether it's how we test. And in many places around the world who have done reasonably well in dealing with Delta, you get to a stage where you have that self-monitoring as well. We're not at that stage yet, but let me assure you that our contact tracers are on the job. They're doing incredibly well given the circumstances. And again, when you look at the number of cases we have and how many days we are into the pandemic or this outbreak, relative to other states, I think in comparison, given the course of time, people will appreciate all the systems that we've put in place to deal with what we have given our population.
And other people to actually help out the contact tracers.
Can I ask everybody to continue following the health experts and the health advice? But what we are seeing still is, unfortunately, and without giving away anybody's private circumstances, some people who are very sick aren't even getting a test until right the last minute. And then it's almost too late by the time they get to hospital to treat them. So I do say to everybody, the job of our contact tracers is made easier if people get tested as soon as they think they may have been exposed, and that they respond to the health advice. We often have people who are contacted, depending on your circumstances, on a daily basis or every couple of days, especially when there's vulnerable people involved. Our hospital care is outstanding, especially compared to other parts of the world. So I just ask people to be patient, but also to follow the health advice. There are always exceptions. In a population of 8 million, you're always going to have situations where there's an exception. But the vast majority of cases, the vast majority of the way we do things is extremely positive and efficient. But there'll always be shortfalls because of the system and the nature of it. And we also do rely on people to, first of all, tell us everything they know. And second of all, to remember everything they know. And that can be a challenge. But I just want to assure people how our systems are holding up, how we've put planning in place for a long time. We know this will be the most difficult period of time for all of our frontline health workers. And for many of them, they're already feeling it. If you work in a hospital in southwestern or western Sydney, you will already be feeling what many other health workers across the state will feel in the next couple of weeks. And so our job as part of our plan is to share the burden as much as we can, to redeploy the staff that have been trained up to work in intensive care units, to reconfigure some of our hospitals and hospital wards. I'll have more to say about this next week, but I'm really keen to have the clinicians themselves and our experts themselves explain this rather than coming from a politician, to give everybody the degree of comfort I have. I'm not suggesting there won't be bad days. I'm not suggesting there won't be examples where people feel let down. But let's face it, that happens even when the system isn't in a pandemic. We have one of the best health systems in the world, but no system is perfect, and every system is subject to a number of challenges. So I'm not suggesting it's going to be rosy by any stretch, but I want to, as much as possible, warn people about what to expect in the next few weeks, but also say to people we're expecting it, and not to be concerned that it's not to be concerned to the extent that we're anticipating this. We've been planning for it, and so many good people. I mean, my hats off to health workers who work with COVID patients every day and then go home to their families. Now, if that's not sacrifice, if that's not being a hero, I don't know what is. And I also want to give a shout out to our ambulance and paramedics. Anytime they're called out now to a home, they may not know if that home's been exposed or not, and they're putting themselves on the line every day. But even ambulance and paramedics will have different roles. They may be asked to take patients to different locations based on where we're spreading the load. So the whole system is kicking into the next gear, and I appreciate there'll be some very difficult days beyond what we've experienced. But then there's also opportunities for us to look positively at the future and know that this is, the efforts people are going to in the next few weeks is the result of years and years of planning, years of people putting literally their sacrifices on the line to make sure they deliver great care to those who need it.
We have heard reports that the plan is to scale back on the contact tracing and rely on the app. I mean, could you explain a little bit the rationale behind that? And also, is there a danger that we might see, as they did in the UK, a kind of pingdemic with thousands upon thousands of people being asked to isolate?
Yeah, just to be clear, we are starting to present what our systems will look like once we get to 70% double dose vaccination. So we have to appreciate that when you have the vast majority of your adult population vaccinated, the way you do things automatically changes, because the case numbers will be higher, but the rate of hospitalisation will be much lower. And it means you focus your attention on different parts of the system. You focus your attention on keeping people out of hospital. And therefore, the way you do things changes. And obviously, if you're a fully vaccinated Australian coming back home, there is no reason why, when the vast majority of us are vaccinated in the community, there is no reason why you can't home quarantine, we can't do things differently. At the moment, as you all know, we have thousands and thousands of health staff and police staff and ADF busy with the hotel quarantine system, when in fact we have only a handful of cases in overseas travellers with the virus, and yet significantly more in the community. So it stands to reason that once you have a safe rate of vaccination in the adult population, you start to transition. So whether it's contact tracing, where there'll be better use of technology, whether it's the quarantine system, whether it's the way in which we treat our intensive care patients during the peak of hospitalisation, things will be done differently. It doesn't mean the system isn't able to take care of people, or it doesn't mean people need to worry as much as perhaps some might suggest. But what it does mean is we have to be open to living with COVID and what that means into the future, because what we're doing now is not sustainable. We can't be in lockdown forever. We can't have the number of people dedicated to the hotel quarantine system in that way forever. So things are shifting in a good way, because we can see what life looks like when we're living with Delta. It's not like the way we're living now. I'll come around here.
You all the Deputy Premier, just an update on the plans for Wilcannia. We know that motorhomes are going to be there soon, but want to know who's going to be in charge, and are they going to be working closely with the local Aboriginal health services just to make sure everything is actually culturally appropriate?
Sure. DP? Yeah.
Yeah, well, that's a good question, and what we have been doing is been working with the community. We've got the local health service, of course, we've got the community on side. When I announced that there were 30 motorhomes being deployed to Wilcannia to be set up at the local, the council's own camp motorhome park, that was all part of a broader approach. Also, DPC, Department of Regional New South Wales, Department of Resilience, all working together to make sure that we actually make this as easy as possible. And it absolutely, it's in line with community sentiment and community expectation. And we'll keep working at it. We'll refine it. We'll scale it up if we need to. I mean, today's case numbers, another 7 cases in Wilcannia, so we're not over the hill there yet. But the good news is Wilcannia and the Central Darling has seen an acceleration in vaccination, which is going to be the key in managing this.
On the fact that there is misinformation getting into these communities, and quite a lot of Aboriginal leaders have said that there's this really concerning misinformation about vaccines. How are we going to get the rest of the community vaccinated if these things are infiltrating the communities?
I don't think that happens just in the Indigenous communities. That's happening right across regional rural New South Wales and across Australia and across the globe. There's a lot of misinformation online in relation to vaccinations. You know, we keep playing the brand debate between Pfizer and AstraZeneca, and we get an abundant supply of AstraZeneca at the moment. It's safe, it's effective, and it's available. And we've just kept cutting through. And in those communities, I've spoken to a couple of people from Wilcannia who have told me that there is a reluctance, there's still a fear, and we've got to use locals to actually sell that message better. Having access points at a very local level, having the ability to have ADF or the Royal Flying Doctors in those communities, all our health units with walk-in clinics, makes it easier to explain. And I think Adam Marshall had an example in his electorate where there were some Aboriginal people that were fearful but ended up getting vaccinated. So they become ambassadors in one way for us to keep making sure that people get vaccinated. But there is hesitancy and a reluctance in across many communities. Get off social media. The truth isn't there. I listen to the health experts, and the health experts are saying that AstraZeneca, that we have an abundant supply of, is safe.
Deep cleaning or testing, and obviously the concern for residents there?
Yeah, look, the numbers again today in Western New South Wales, 53 cases, and the vast majority were in Dubbo. Dubbo continues to be the area of concern for us. West Dubbo and the aged care facility is one of those. And there is a series of processes and protocols in place in relation to deep cleaning. Yes, you're right, they were vaccinated, which shows that if you are vaccinated, you can protect and you can minimise transmission, but it doesn't mean you can't get COVID. So the reality here is we keep focused, and the communities come out. Dubbo's numbers in vaccination rates are skyrocketing. Again, doubling their first doses in over a week. So proud of that community and encouraging that community to continue to get vaccinated. We know we won't get back to zero. The plan to get out of this is through vaccination, and a call out to that community. 1, to get tested early if you have any symptoms. It's going to help us keep an eye on what's happening in the community. But number 2, continue to get vaccinated.
Sorry, I promised this. Sorry.
Now, how many people have been transferred to Sydney hospitals or other major regional hospitals? We did hear that some were being sent to Tamworth, and that might be the reason for the sewage detection.
Oh, look, there's no question that in regional rural New South Wales, we are a network of local health districts. We have base hospitals, we've got major hospitals, and not every hospital has an ICU unit or has the ability to respond. So I'm sure there are people being transported from not only Dubbo but other parts of the state to a safe environment, into a hospital that has the resources. But that's the reality. We live that reality even outside of the pandemic. You know, a lot of our services aren't local; they are at major hospitals, and it's part of our approach to dealing with this pandemic.
I understand that the ambulance is considering surge changes as well. One of which includes using other emergency services such as police to drive the ambulance. Is that something under consideration, and one paramedic on board
Look,
only?
I've not heard of that, but what I will do is commit to having our clinicians explain the changes that will be placed on the system, and that'll happen next week. So I'd much rather it come from clinicians who've actually put the plan together and been developing the plan for the last 18 months.
At the moment, we're having 5 schools a day being closed for COVID at the current caseload. When we go to open up in October, what's the contingency plan to, I guess, we've only got 5% of students in class at the moment. We're having 5 schools a day being closed. When all students go back, it's likely that number will increase. What's the contingency plan on shutting down schools every 5 minutes?
Well, obviously, there are a couple of things that will be very different on October 25 when children start going back to school in earnest. And that is, firstly, all the teachers will be vaccinated. There'll be a much higher rate of vaccination in the adult population. And we anticipate there'll also be rates of vaccination in 12 to 15-year-olds, which currently don't exist. So there's a number of things that will be different by the time children go back to school, plus the fact that high school students will be required to wear masks. There'll be those extra provisions that health and education have been working on. So we would never be in a situation where we would advocate something which we didn't feel was safe, but can I promise there won't be any disruption? No, because we don't know if there'll be outbreaks in a particular area, and from time to time there will be. We're going to experience that, but in the main, it's really important for us to make sure that when we do have that level of adult vaccination, and then 12 to 15-year-olds will also start being vaccinated in the next little while, that we make sure that one of our priorities when we're opening up is getting kids back to school.
There's a story today about eventually we'll transition to using apps for contact tracing. What would happen for older people who don't use the Service New South Wales app, or even teenagers, for instance?
Well, look, I think what we've demonstrated even before this outbreak is our ability to make sure that we're very inclusive with the services Service New South Wales provides. So, for example, we do have provision already for people who didn't have QR codes to check in, for example, who didn't have smartphones. So we'll make those plans very clear, but I just want to make sure every citizen knows that we'll account for every type of circumstance. We don't want anyone to feel excluded, quite the opposite. Our plans are all based on inclusiveness to make sure everybody feels safe and is part of the system. And of course, we'll also make adjustments for people who may not have access to technology in the way that others do.
Contact tracing, obviously some changes to the app in terms of how venues and everything are chased up. You're still hiring more contact tracers in the local health districts. The surge staffing, how long will that continue for? Do you know when it'll come back?
Well, obviously, there'll be a transition. We've already started transitioning, as Dr. Chan and Dr. Gale and others have already spoken about. We're now advising people by text message to make sure they get the message as soon as possible if they test positive. So we're already starting to use technology in a much more efficient way, simply to make sure people get the message as quickly as possible. So we've started the transition, but in earnest. The technology doesn't kick in earnest across the board until we hit that 70% double vaccination rate. But it's a process of transition. It's a process of starting to make your systems quicker, more efficient and future-proof. Because remember, we're going to get to a state in October, November when we have the settings in place to live with COVID indefinitely until we know the virus leaves the planet, especially the Delta strain. So we know then by that stage we would have transitioned to what living with the Delta strain looks like. And we've started that process now, because you can't literally change everything overnight. You have to do the planning and you have to put things in place.
How long will that be in place? Do you have any plans to reduce staffing in coming months, within a year? Is there anything?
Well, that's what I've just said. When we hit 70% double dose, which is mid-October-ish, that's when the transition will start well in earnest about going from the systems we have to a more future-proof system and what living with Delta looks like. So we're obviously using some technology now which is making things quicker, more efficient and to scale. But obviously the transition won't really start in earnest until mid-October-ish when we hit that 70% double dose. And that depends on everybody who's had their first dose, making sure they go and get their second dose. But also we want to see the first dose rate hit 80% in New South Wales as quickly as we can, because then we'll know that our population has signed up to the 80% plan. So between 70 and 80% first dose is what we're keenly looking at. So we're just keen to make sure we keep getting people who haven't had any jabs coming forward to get the jab.
Again, obviously at the moment the light at the end of the tunnel is that 70 to 80% vaccination rate, but there is every chance that there could be a third wave next year. Do you know what that will look like?
Look, the Delta strain has proved to be formidable in dealing with traditional systems. The Delta strain has thrown the whole rule book out the door. And other states will come to realise this when it's their turn to go through what we're going through. And I don't wish it upon anybody, but it's a confronting situation all states are going to have to go through. So we can say confidently that our vaccines have demonstrated huge efficacy or efficiency against the Delta strain. So once you hit 80% double dose population, there is no reason why you would have a statewide lockdown ever again. That is the intent, and that's why we know with the Delta strain that unless you have those high rates of vaccination, you are susceptible to having to lock down communities, and that's what we want to avoid.
I suppose the only thing is that it will get to a point that where we'll need a third booster shot or something like that, that it will wear off. So at the moment it's great that we've got these targets, but are you concerned about what it's going to look like?
No, I've already asked the questions without breaching confidence in National Cabinet. The federal government has ample supply of the booster shots, but we have to treat this like we can't yet, and I don't want people to think I'm being flippant. But once you get to living with Delta, we will be treating this like you treat it's a horrible disease. It's not like the flu. It's much more contagious and much more deadly. But every year we get a flu shot, or those most vulnerable do. We're going to have to do that every year. So once a year we're all going to have to go and get our shot, but obviously it'll be a normalised process. Most people will get it from their workplace or through GPs, much in the same way you get your flu shot. But obviously it's a race for us now to vaccinate our adult population as quickly as possible, then the 12 to 15-year-olds, to give everybody protection, as much people as possible protection once we live with Delta. But living with Delta means social distancing, QR codes, vaccine passports. It also means once a year getting a booster or a jab to vaccinate.
Could you give us an update on how many facilities now have outbreaks, and just kind of assessing the situation? Will you be looking to change anything in terms of how prisons manage cases when they see them, how they transport patients? Yeah. After the current outbreak?
I might ask Dr. Gao to answer some of those
But
questions.
just specifically, is the government looking at changing how prisons operate when there are cases?
Well, I think there's already plans in place, but Dr. Gao's more across the detail than I am. Thank you.
Thanks very much. Yes, in relation to prisons, clearly the recent examples are of concern. The outbreak at Parklea, which currently has a total of 96 cases. And there's a lot of work going into managing that with all the parties involved and being led by Health by St Vincent's, who provide the care in Parklea. A big effort around infection control in the facility to make sure that all the staff there have the appropriate PPE, that vaccination uptake is as good as it can be, and there's been a lot of vaccines delivered and an intensive effort as we speak around vaccinating the inmates and the staff. So clearly the prison setting has been a focus since early in the pandemic, and a lot of preparedness happening in that, and discussions that are ongoing with corrections, with Justice Health and with private providers in the prison settings.
Has the fact that it's a privately run prison presented any obstacles in how Health's managing it?
The Northern Beaches Hospital maternity unit. Do you have any information about that?
Yes, we are aware of an exposure in the Northern Beaches maternity unit. I understand that there has been a staff member and a patient as well who's tested positive, and I understand that that's currently under investigation, and all the usual measures that we would undertake when there has been cases in a facility, including cleaning, testing of staff, the risk assessment of the facility, all of that is underway, and we'd be happy to provide an update in due course.
Just on that, sorry, pregnant women have never been put in a priority group for Pfizer. They've been told that they can't get AstraZeneca and that they need to have Pfizer, but they're not in a priority group. They're all, or most of them are in the 16 to 39 age group. They've had to wait the longest. We're now hearing of Northern Beaches Hospital. We've also heard of Prince of Wales Hospital, problems in the maternity ward. Is it now time for pregnant women to be prioritised for Pfizer and put to the front of the queue?
Yes, thank you. So pregnant women are strongly encouraged to get Pfizer. It is recommended, and that is the Commonwealth's advice, listing them as a priority population for vaccine, and I believe that was the Commonwealth's advice in July. In terms of access in New South Wales clinics and via GPs and pharmacies, well, pharmacies not because they're AstraZeneca, but there are multiple opportunities for pregnant women to get access to Pfizer, and we'll be certainly looking as we get increased Pfizer supply in New South Wales to make sure that pregnant women are able to access that. And I'd encourage any pregnant woman out there who wants to have the Pfizer vaccine and is struggling to get access to one, to please discuss that with your GP, with your midwife or with your obstetrician, who can help you to facilitate access to Pfizer vaccine as soon as possible.
Last question.
concern around children and COVID. Is that now becoming your fastest growing category? And can you tell parents who are really worried, are you seeing any under 12s in ICU?
Look, I think that for children, clearly we have seen more children affected in this Delta outbreak compared with last year. And as we've talked about previously, we have seen outbreaks in schools, even with a small number of people there, as well as in early childhood settings. And what we're seeing is often, especially in the areas most affected, there are large households, often quite a number of children in the household, and children who interact with each other in households. So transmission is more easily occurs between children. So clearly that's an area of concern. But the best thing that we can do to protect children is for adults and those around them to get vaccinated. And all the measures that we usually talk about, such as following the public health orders, getting tested, and clearly when vaccine options open up for younger children, then clearly we'll be looking to adopt that and make that available. Thank you.
The 12 deaths that will alarm people today, 12 deaths. Do we know the vaccination status of all of them?
We do, and we'd be happy to provide that. It's just quite a lot of detail to provide here today, but we'll certainly make that available.
What would you assure people in terms of the majority of them were unvaccinated, or what would be your assurance to people about the efficacy of vaccines and why we saw those 12 deaths today?
Sure. Similar to the deaths that we have reported on other occasions, many of those who died today are older, did have existing comorbidities, and were unvaccinated or had one dose. So it's been a similar pattern to what we've previously reported. And again, to remind everybody of the importance of vaccination and how effective it really is to prevent serious illness, to prevent people being hospitalised, to prevent ICU admissions, and to prevent death. So again, please get vaccinated if you haven't already done so.
Dr. On the hesitancy issue, particularly for elderly people, what do you say to elderly people who look at the effectiveness of Pfizer against AstraZeneca and think, well, hang on, Pfizer is more effective? What would you say to them?
Look, I think both vaccines are highly effective. They both provide excellent protection against the ongoing transmission of COVID and protection against severe illness. And I would encourage anyone who has access to AstraZeneca to take up that opportunity. That is available through pharmacies, available through GPs, available to New South Wales Health, through New South Wales Health clinics. I myself have had 2 doses of AstraZeneca. It is a good vaccine. I would strongly recommend it. And if people are hesitant, please do talk to your GP if you're unsure. Thank you.
Just on National Cabinet, there's obviously a massive split on the pathway forward. How much is actually being achieved in National Cabinet at the moment? Do you think that it should be, continued on post-COVID?
I think most of the state leaders and chief ministers are coming round to what the experience has been in New South Wales. I think I've sensed certainly a shift in how people think Delta will coexist with us in Australia, and I'm very optimistic about that. And I just urge all of us to continue to stick to the national plan. Everyone's pathway will be different. Every state is different. We can't pretend, when the Federation was formed, the states were very similar. And since 1901, it's fair to say, demographically, population-wise, economy-wise, we're all very different now. And that will be reflected in how each state has to deal with Delta. But I think the common aim we have is to work together to support our nation, to support Australians. And that's what we've been committed to in New South Wales. We'll continue to do that. But I actually have sensed a shift, and I think people are realising what we realised because we were confronted with what we were in New South Wales, that Delta is a game changer, that COVID is here to stay for the foreseeable future. So we have to come to terms with going through this transition phase. In New South Wales, as I said, will go through the most difficult time in the next 2 months. And that's always been the case. And other states will go through a similar difficult time when that is. But we can't, I think, forever ignore the fact that Delta is here to stay, and we have to deal with that. Very last question, yeah.
Island of New Zealand, where there are currently no COVID cases, are being told that the Australian government won't let them fly home. They're willing to quarantine. Federal government suggests it's a state issue based on quarantine caps. Is that the case?
Oh, look, I don't know of that example. It hasn't been brought to my attention. But even with our quarantine at half capacity, we're still bringing home more Aussies than anybody else. And as I said, once we get to 80% double dose, I'd love to welcome all Australians, no matter which state they're from, through Sydney Airport. And I'm looking forward to that. Thanks, everybody.